Imagine you had a son or daughter in their late teens. Little by little, you realize that things are not right. They're talking to themselves, stay inside their room. They won't go out because they think people are threatening them. They refuse to eat because they think you're trying to poison them and they can't think straight. These are some signs someone with schizophrenia would have. As you can see, this is our organization named Schizophrenia Project Awareness, and this is our emblem. Schizophrenia is probably the most unforgiving and debilitating of all mental disorders. It keeps your loved one from functioning in society. If you have a parent with this disease, it is a lifelong challenge for you because schizophrenia is usually an early onset disorder and can occur as early as when you reach your mid-teens to your early 20s. Living with a family member with schizophrenia may be challenging if your loved one does not want to seek help professionally. They may believe that they are fine and that the others are the ones with the problem. Consequently, their symptoms may become more severe and they may become more withdrawn. Their disorder may advance and worsen, and they can become chronic until they are convinced to get help. Today, we are going to talk about the problems, the causes, the solutions of schizophrenia, and how it inspired our organization, S.P.A.
S.P.A. is an awareness group to give a voice with those who suffer from schizophrenia. Those who suffer from schizophrenia are usually non-sociable with family and aren't able to make or keep friends. They don't bring themselves to bond with people in order to develop a relationship. Those who have no one to take care of them or encourage them to try new things begin to drift to what is called a low social level. Schizophrenia affects about 1% of the world's population. Awareness to schizophrenia has shown a link to homeless people. Roughly between 10 and 40% of homeless people have this disease. Families don't know how to help or where to get help for their family member who suffers. This results in frustration and ultimately the family member being thrown out. A survey conducted in the United States and the United Kingdom this survey showed majority of people taken from the police station to the asylum do suffer from schizophrenia. Homeless people have very little access to medical care. This results in them not able to control their outbursts and such. Schizophrenia awareness is unknown.
Brain scans of identical twins show that the fluid-filled ventricles on the schizophrenic twin is much larger than the one that's the normal twin in the center. The activity level on the top part, brain scans will show that a schizophrenic person could also have higher or lower brain activity than a normal person, and the normal one is up on top where they have more frontal cortex activity on that. Symptoms of this disease can make a person withdrawn and unsocial. It might be misdiagnosed as depression. Hallucinations, such as hearing voices, is very common in schizophrenia. Seeing imaginary things are also very common. Paranoia sets in when people with schizophrenia may feel that everybody is against them and out to get them. Feeling withdrawn from social groups are common because of unusual suspicion, like I said before, that people are out to get them, so they tend to be more withdrawn. Schizophrenia patients have trouble keeping the house clean. Normal everyday tasks and chores, they just don't have the drive to do it, and personal hygiene may be a problem as well. Medication for schizophrenia, although medication may help with symptoms, they work by blocking certain brain chemicals. This may cause side effects. Some side effects of drugs are tremors, weight gain, pacing back and forth, insomnia could be part of it too. Drugs may also interfere with other medications the patient is on. In most cases, the patient with schizophrenia will be on medication for a long time, probably for the rest of their lives. And thank you very much.
Causes of schizophrenia. Doctors are not sure what causes schizophrenia. People who are in close relations with someone with schizophrenia are most likely to develop this disease. Schizophrenia affects 1 out of 2% of the population worldwide. Men and women in all ethnicities are affected equally. Men tend to develop this disease in their late teens or early 20s, whereas women develop in their mid-20s to early 30s. Doctors believe that environmental factors also play a key role. Some symptoms of schizophrenia. People that suffer from schizophrenia often lack an association between ideas and events. 20% of people have visual hallucinations, where 60% have auditory hallucinations. Nearly 1/3 of people diagnosed with schizophrenia will attempt suicide. Schizophrenia never goes away, but as you get older, the hallucinations decline.
The solution to schizophrenia. There is no definite cure for schizophrenia, no matter how many medications there are. The medications are only limited, and they're a combination of drug, psychosocial, and support therapies. The limited use of medication only helps with the psychosis associated with it. It cannot help find a person a job, help with their communication skills, or help them with their coping skills. What they really need is love and support from their family and friends, and sudden stops in treatments could lead to a relapse in symptoms. Psychotherapy helps maintain their medication, help them learn their social skills and support their goals and weekly activities. They go through therapy or rehabilitation therapy to help a person regain confidence. Group and family therapies usually help decrease social isolation and relapse rates of individuals. Medications are a combination of antipsychotic, antidepressant, and anti-anxiety meds. These usually help normalize biochemical imbalances that cause schizophrenia, and it also helps with the positive and negative symptoms, such as hallucinations or discomfort and so on. Usually side effects also cause patients to stop their medication, and it would also cause a relapse again in their symptoms. That's it.
So now we have talked about the problems, the causes, the solutions of schizophrenia, and how it inspired our organization, S.P.A. Doctors aren't sure what causes schizophrenia, but they know it's genetic. So people with this disease isolate themselves from the world because they're scared to interact with others. People with schizophrenia have to take medication to control their illness, but there's no known cure for schizophrenia. It's a long-term disease.